Hey friend, welcome to Grounded, the vestibular podcast. I'm Dr. Madison Oak, aka the Vertigo Doctor. I am the vestibular physical therapist who is here to help you with all things dizziness, imbalance, and vertigo. In this podcast, we explore the fascinating world of vestibular disorders. Come with me as we dive headfirst into a journey to discover the mysteries of the brain, the inner ear, and the balance mechanisms that keep us grounded. Whether you've been managing dizziness for one day or 25 years, we're going to get real about what it takes to manage dizziness, handle the anxiety cycle, and thrive, not just survive, with your vestibular disorder. First, I want to remind you that this is never medical advice. Remember, this podcast is for informational purposes only and may not be the best fit for you and your personal situation. It shall not be construed as medical advice. The information and education provided here is not intended or implied to supplement or replace professional medical treatment, advice, and or diagnosis. Always check with your own physician, medical professionals, and healthcare team before trying or implementing any information found here. Hello and welcome back to Grounded. Today we are going to be talking about medication overuse headache. This is something that I see honestly far too often, and unfortunately it's one of those things that does need to be managed a little bit differently. But before we get into that, we are going to do this week's win of the week. Today's win is by Allison. She has been a vestibular group member for some time and has always really struggled with things like driving and leaving the house long distances, things like that. And she says, huge win today. So I wanted to share because I'm really excited about it, which I'm excited too. For the last year, I would only drive around my small town by myself due to the panic of being dizzy. Today, I was able to drive by myself 20 minutes away and do some shopping all by myself. The best part is the drive wasn't bad at all. The dizziness was very minimal. This is huge. Go you, Allison. I'm really excited for you to have been able to get here, do these things, and figure it out on the driving front. It is so hard. We recently had a how to return to driving module. And honestly, returning to driving is one of those things that is one of the most difficult things to get back to. And getting back to it requires a lot of consistency and effort and just a lot of things generally. So I'm proud of you, Allison. Go you. All right, let's talk about medication overuse headache. Medication overuse headache, or MOH, I often accidentally call it migraine overuse headache. That's not what it is. But medication overuse headache is one of the challenges with living with a vestibular disorder because, of course, my job is to give you lots of options and actionable strategies to help you thrive. And one of those things can and often is acute medications. The problem is that many people with vestibular migraine rely on medications to manage their symptoms only, but we actually need a whole toolkit. And we had an episode about toolkit quite some time ago, but it is on here if you find it. I will try to link it below. So it's just an important thing to understand. Medication overuse headache occurs with frequent use of certain pain relief or even migraine relief medication. So when this happens, it's because someone is using more than nine or more specific medications per month in order to manage their migraine. So these are things like pain relief medications, such as Tylenol, for example. It is specific, or naproxen or Advil, Motrin, so your NSAIDs plus Tylenol, basically. Your combination pain relievers, so Excedrin, which is like aspirin and acetaminophen plus caffeine. And then the butalbital. I have the hardest time with that word, butalbitals. So butapap, lanorenal, and others, as well as triptans. So these are your Imitrex, Zomig, etc., Zavzpret, sumatriptan, whatever. And then opioids. So OxyContin, Roxicodone, etc. So, those classes of medications. The CGRPs do not seem to contribute to this, which is great. But this is where having a toolkit is so important. So you don't have to always use those because that's not what we are going for. So when you start to use more medications and more and more and more than 9 or more times per month, then your brain starts to build more receptors to pain. But if you don't have pain, the same exact thing happens, basically to symptoms, in order to tell your body that you are still having these symptoms. Because again, migraine itself is your body screaming at you that something is wrong. Something is going on. What it is, I couldn't tell you over this podcast. That is not the point of this podcast, but something is wrong. And if you suppress that signal, your body gets more angry at you and is like, okay, well, now we have to build more receptors to that symptom so we can continue to tell you that something is wrong, even though you are trying to suppress us. The same thing happens if you get chronically dizzy and you take a benzo every day, like a Xanax, Valium, etc. Your brain is going to start to work around it. And that is because your body is trying to tell you something that you are not supposed to be suppressing. We are supposed to be learning what's wrong and doing something about it, which is what we do in vestibular group fit. So people with migraine are, of course, at risk for medication overuse headache because if you have frequent symptom episodes and you're trying to do trial and error of different treatments and you're like, I'm going to try an NSAID this time and a triptan that time and butalbital this time, whatever, they add up together. So it's not 9 triptans, 9 Advils, and 9 Tylenols. No, it would be too many if you did 3 triptans, 3 Tylenols, and 3 Advils. Like that would be already to that MOH standpoint. So, of course, these symptoms can be chronic, and that's really frustrating because a lot of people are like, I don't know when my attacks are versus when I'm just having like interictal symptoms and things like that. That's when an app, for example, like Migraine Buddy or keeping a migraine diary it's on your phone comes into play because you don't want to not treat attacks because not treating attacks, this is where migraine gets so frustrating because not treating an attack is equivalent to more attacks. And if you treat it incorrectly, you're also going to have more attacks. So you really have to walk this fine line of having a toolkit. Again, toolkit episode, go and listen to it. I will try to link it below if I remember. Having a toolkit, not always taking the medication first. And also learning when to take your medication by tracking. So I like to say if you use all of your tools, so you have a high protein snack and water and electrolytes and magnesium and ginger and use your headache hat and your neck warmer and your essential oils and neck balm and all of the things, and in 45 minutes to an hour, you don't feel like that's going down or you feel like it's getting worse, that's when you say, okay, now it's time for my acute medication. And that's also why having different things in your toolkit for different times is so, so, so essential. So if you are using these relief medications more than 2 or 3 times a week, if your headaches or dizziness are becoming more frequent and more intense, you notice that your medications are becoming less effective over time, and you feel like you're stuck in a cycle of taking medication, feeling temporary relief, and then having it return in like 8 to 12 hours. If any of that sounds familiar, you may be in this MOH zone, and it's something that you need to talk to your doctor about. I also want to note that this can happen to people who are taking medications for other reasons. So let's say you have, I don't know, knee pain or back pain, and you're taking Advil for that knee pain or back pain. If that is you, then if you're still taking this more than 9 times a month, let's say you're like, I have this chronic knee pain and like 5 or 6 times a month, I take Advil for my knee. And then you're like, I also get like 4 migraine attacks a month. And so I take 4 triptans. You are riding that line. of taking 9 or more per year. So this is where you really need to be careful because and track and make sure you're counting and all of the things because again, it really can get convoluted quickly because it's an additive thing and it counts even if it's not being taken for migraine. Another thing that I want to note is that some people say that naproxen is not a problem, but I have talked to multiple headache specialists and neurologists about this who I really, really trust, who I'm not going to name here, but really, really trust, and gotten it on their good word that naproxen counts. So if your doctor has been like, just take naproxen 6 days in a row, that is likely not a good option if you are trying to avoid medication overuse headache, unless those 6 days are the only times that you're taking medication that month, in which case, totally fine. Do your thing. Um, for most people, of course, talk to your doctor. This is not medical advice. As the beginning of the show always says, all of the things. But I have seen some people who are like, yeah, I take for my 6 attacks a month, I take 6 triptans. Great. You're under that number. And then also, I'm taking 6 naproxen, which is an NSAID. And my doctor told me that those 12 are fine. Not correct. You likely should find a new neurologist. Um, Okay, so if this sounds like you and you're like, I think I'm in MOH land, we need to get out of MOH land. This is really difficult because once you're there, you obviously want to continue treating the attacks because more attacks beget more attacks. But this is when it's a really good idea to start to introduce something like a neuromodulation device that can help abort an attack, like a gamma cord, Truvaga, Cephaly, whatever, um, in order to help you kind of not be in this zone. So consult with your doctor. Tell them, hey, I think I'm in medication overuse headache land and I need a different thing to help me break these attacks. Introducing something like a CGRP, also really helpful. So making sure that they understand what this is. If not, please find a new neurologist. I know some people who have to literally quit cold turkey and never touch an NSAID again. Like I literally know some people with vestibular migraine who are like, I literally can't even take Advil once a month for my knee pain. Because that's going to send me into an attack, an overuse headache, literally even with once a month if you have a history of this. So it can get really convoluted. Again, switching to preventative treatments, if you're having enough to where you're taking these more than 8 or 9 times a month, it is likely that you are really nearing chronic migraine land and likely need a preventative. I know a lot of people are anti-medication overall. Medication is not a bad thing. Medication creates space. I need to do a podcast on that. It creates space for you to be able to do other things that help your body. This does not mean it needs to be a long time forever thing. It just means that, hey, short term, I need you need to say, okay, maybe I need to take a really low dose of something preventatively in order to get me to a place where I can be successful in the future. Adopt non-pharmaceutical strategies like we talked about, rehab, mindfulness, stress reduction, breath work, all the things we talk about in the toolkit episode. If you were like, I have pain and therefore I need it, you need to likely do some pain reprocessing therapy. Kate Schwab is an excellent somatic therapist. I follow her. You can go find her there. That is really helpful. She's excellent with pain reprocessing. And then also going to physical therapy for your knee pain, back pain, whatever. And make sure this physical therapist, there are good ones and bad ones all over the place. Make sure it's a good one. They are prescribing you strengthening program at home. They're making you move again. It is not a time where you just like go for massage and dry needling or something like that. That is not going to help you long term. What's going to help you long term in physical therapy, all the research points to, is strengthening your body in order to help. Like knee pain needs quad strength usually. Back pain needs glute strength. All of these things need to be considered. And then stay patient and consistent. I know it's really uncomfortable to have these symptoms, but finding ways to say, okay, I have an alternative to getting through this is really helpful. Preventing this in the future. Remember, prevention is key to avoiding overuse of these medications. So track your symptoms and track your medication use. I really like the red light, yellow light, green light theory where people do like today's a green day, today's a yellow day, today's a red day. On red days, I take medications. On yellow days, I use other things. And I think that's not as like I had this symptom and then that symptom. And then it gets less obsessive, I think. So I really like that way of tracking. Um, Set boundaries on medication use. So limit those acute treatments to no more than twice per week. Because if you can get less than twice per week, that means, okay, I'm taking less than 9 per month, which is great. And then communicate with your provider regularly. Check in with your healthcare team. Join us in vestibular group for alternative ways to take less medication. There are tons of people in group who are like, I'm taking less meds because of the things that I'm implementing here. Balance your blood sugar, drink enough water, have magnesium, have electrolytes, do the things that work for your body in order to make it so you do not need as many acute medications. I hope this makes sense. If you have any questions about medication overuse headache, please let me know. I am here for you. I love you, and I will see you next time. Bye-bye.